everyone. This is Justin Smith with Integrative Health Supplements, and on today's episode of Integrative Health Chats, I have the pleasure of sitting down with Jamie Yesh and John Paul Slonkosky as we dive into this whole idea of senior care and in-home care around acute and chronic pain and treating the body as a unified whole, not as individual parts. Jamie is a board-certified physical therapist, and she received her doctorate degree from Boston University. And John Paul is one of the co-founders of Integrative Health Supplements, and he has an extensive background in senior care and healthcare. One of the things that I found really intriguing about this episode is how Jamie practices her profession. She sees her patients as a unified whole, not as individual body parts, which is fantastic because at IHSupps, we also see the body as a unified whole, each part and each system connected to the other. And we believe that this is something that is often forgotten when we're unhealthy. So we would rather focus on immediate problems and the specific symptoms instead of trying to find the root cause and examining our health as a whole. I'm super grateful that you could join us on this conversation on Integrative Health Chats. Stay tuned and enjoy the episode.
Hey everyone, good morning. This is Justin Smith with IHSupps, Integrative Health Supplements, and I'm really excited today. I'm actually down at our Ohio office, and we have a really exciting guest on, somebody I've known for quite a few years now, was introduced through a coworker, and her name is Jamie Yesh, and I'm also with John Paul Slonkosky. He's a co-founder of Integrative Health Supplements and Zoa CBD. You guys?
Good morning, Justin.
Good morning.
Good morning.
Jamie, good morning. Thank you so much for joining us, John Paul. As always, it's a pleasure being here with you.
Fantastic. I'm so excited to talk with Jamie again.
Yeah, no, definitely. The first time we connected was definitely, that's why we're doing this.
Exactly. We want to bring this conversation to our audience here at IHChat. So
absolutely. Well, I don't want to steal your guys' fire here. So Jamie, if you'd like to take some time, introduce yourself and tell the world about what it is that you do, who you are, and we'll start there.
Hi. So, thank you guys for having me so much. I'm really excited about today as well. So a little bit about me. I'm a physical therapist. I got my doctorate in physical therapy in 2007 from Boston University. And since then, I've been doing, a variety of different things, mostly kind of based in outpatient and home care, and then also do some lectures nationally around the country. And it's been a, very rewarding experience. I have gotten a couple certifications along the way, but I've kind of chosen not to specialize in anything, particularly so I can kind of see all my patients through a bigger lens, so I can kind of treat them as a whole person versus individual body parts, which is something, I am really passionate about.
And absolutely part of the key for this conversation, Integrative Health Supplements was founded on an understanding of the person as a whole, as not just individual body systems, not just a machine to be fixed, but mind, body, spirit. So absolutely resonates. And I'm excited for you to say a lot more about that in your practice. So,
John, before we go on, definitely. Tell the world about you.
Yeah. So my background, I always say is in and around healthcare. So I worked for a hospital. I worked around hospitals in patient satisfaction. And then I was fortunate to work in senior care space, started a business, home care business, and by working primarily with seniors, was able to be involved in their care and be involved in their journey, their healthcare journey. Obviously, we met them later in life, although we took care of people middle-aged too, but we often took care of seniors, and just totally shaped my perception that a person's healthcare journey needs to be one of wholeness, one towards wholeness, towards wellness, and one of integrating their whole person of mind, body, and spirit. So we absolutely interacted with PT often. Our caregivers were there taking care of activities of daily living, and oftentimes the PTs, the OTs, and the home health, clinical home health was there right alongside with us. So Jamie, I'm excited to hear about your experiences and how you view, specifically pain is what I'm excited we're going to talk about, because there's chronic pain, there's acute pain, And I know the understanding of pain has been transformed, is changing, and I'm excited for you to share about that. So Could we dive into that aspect right now? Like, what's your understanding of pain?
Yeah, it sounds great. So I think to start out, if that's okay, I just wanted to talk a little bit about like why pain is kind of at the forefront of the medical community right now, because it's really amazing that the statistics show that 1 in 3 people have some sort of a chronic pain going on. I think something that's important to note is that when the medical community says chronic pain, we're not saying that your pain is never going to go away. And I think that's a common misconception. I think people hear chronic, they hear long-term, they hear forever, and they have this sense of hopelessness. And that's actually not the case. In the medical community, when we say chronic pain, we mean that it's been going on for more than 3 months. And that because of that, there's a whole list of things that happen. And if we don't treat that list of things that happen because it's been going on for 3 months, then you're not going to have optimal outcomes. So I think that's something that's really important for people to know.
That's a shorter window than I would have thought. So that's really, that's good. That makes sense. 1 in 3 persons. That makes a lot of sense.
Yeah. And then so another really staggering statistic is that every year pain and pain management costs about $600 billion. So it's a huge...
Is that with a B?
That's with a B.
So the big B, 600 billion. Yeah. $600
billion. So it's, just to give people a sense of how big this, the pain field kind of spreads. It's a really large problem. And I think most people are mostly aware of it because of the opioid epidemic that we're in right now and addiction. And then because of that piece, and it's unfortunate that it had to come to that piece, the medical community has been looking for other ways to manage pain, which has been a really unique experience for me being a physical therapist, because at our core, we teach people how to exercise. We teach people how to exercise safely with pain. We teach people how to manage their pain. So it puts me and my profession in a really unique subset of people who can treat pain as a whole. So kind of the last few years, I've kind of dedicated a lot of my time to kind of really delving into pain science and using that to help my clients. And I more recently started lecturing around the nation, talking about how we can transform our practice as we understand what pain is more and more.
And I'm going to say that's why your perspective as a practice, the PT, is so important. And I'll speak specifically to a home care situation, because that's where your guidance on how to help this person manage their pain when they want to continue to do their activities of daily living, it outright is essential. Because you have obviously the primary care physician overseeing care from their perspective, but we needed to know what the PT says to do, what's safe for this person, what's going to cause them the least amount of pain, because it's really tough for a caregiver to go in and know, I'm trying to help this person get out of bed, help this person get some exercise, help this person be safe and moving. And if they inadvertently cause pain, it weighs on them the rest of their day. They go into their next client and they're thinking, gosh, I didn't help Mrs. Jones today, even though they probably did best they could.
Right.
So we found our relationship with PT to be so important.
Yes.
And that's why, with your now, evolved understanding of pain. What have you been sharing? Because, I'm just as eager to learn myself right now as our audience.
So some of the take-home things that I teach my clients, that I teach, other practitioners, that I, share with the medical community. So the first and foremost thing is that pain is not a negative thing. That pain, as a definition, is an unpleasant sensation that arises from the body to indicate danger. And so that's not a bad thing. It's supposed to happen. We want to know if our body is in danger. We need to know if our body is in danger. So just because you have a pain doesn't mean that you're in danger. It just means you need to think about whether you are in danger or not. So, as PT, one of the things we do is say, if someone says they're having pain, do you feel like it's a muscle stretching, or do you feel like it's a bad pain and you shouldn't go on? Because there are different types of sensations of pain, and really helping people understand their pain experience becomes really helpful in them getting better, because we need them to, be able to push through some types of pain, but not others. And so one of our jobs is kind of to help people understand the difference between those two, like, different types of pain. And then one of the other take-home messages is that injuries heal. And that's a hard one for people who have chronic pain or pain that's been going on for more than 3 months to really understand, because, what we used to know of pain is that I got injured, I'm having pain. As long as the pain is still there, my injury is still there. And that's actually not the case. 95% of the time, the injury is healed within 12 weeks, which is why that 3-month window is really important, which is why that chronic pain state starts at 3 months. So,
wow. So, this is very illuminating. So, I'll self-admit here. Yeah, you think of pain being present, something is still, quote, wrong, something is still bad. So what are some of the techniques you're able to get people to kind of change that mindset, where this pain is actually a good pain right now, or at least they can move past the negativity?
Right. So one of the really important things to do is we do a lot of pain education. And so educating people on the different types of pain, whether it's acute pain or chronic pain, and then the things that happen to the body when you've had pain for more than 3 months, educating people on that. So for example, like when you're having pain for more than 3 months, your body has been in a fight or flight state for more than 3 months. And because of that, there are changes that are happening at the pain receptor sites. There are changes that are happening in your limbic system. So kind of giving them all those different types of educational pieces and really helping them understand the difference between acute pain and chronic pain, because the way most people see pain is as acute pain. Most people don't actually see their pain as chronic pain. They're viewing it as acute pain, even though it's been going on for 3 months. So the example I like to give my patients is, acute pain. Let's say I scrape my knee and I put a Band-Aid on it, I put some ice on it, and a couple days, the whole thing, it gets better. Something like chronic pain, let's say I scrape my knee and it gets infected, but I don't know it. So I put a Band-Aid on, I put ice on, but the pain doesn't go away because there's an infection. And so without the antibiotic ointment or medication to make that infection go away, that pain is not going to fully resolve. And that's the big switch in the industry. That's the main shift in the industry, is that chronic pain is no longer viewed as a symptom of something. It's viewed as its own disease process.
That is interesting.
And so that changes the way we as practitioners need to treat it, because we can't treat the pain itself because it's not the only thing going on. We can't treat the injury itself. It's not just, there might be some inflammation left, but that's not the only thing that's happened.
What would you cite as the source for that change in the industry?
So the source of the change in the industry?
Yeah. How did this happen? Were studies done, or did an experts?
There's been a lot of work done in pain science, and that's what they've been finding in the pain science. All the literature just points to the fact that in this chronic pain state, they find that there are changes that happen in the receptor sites in the spinal cord and in the brain. They find that the body is not able to perceive pain the same way. They found that the body, you're not able to differentiate where your pain is in your body, which is something that's very important. So I think a lot of times people, they say, we ask them where their pain is, and they kind of point to their whole arm or their whole leg. Right. And they can't tell where their pain is. And before, some practitioners would get very aggravated because they don't feel like they can help somebody unless they know exactly where the pain is. But in chronic pain, one of the symptoms of chronic pain is that you're not able to locate your pain because the whole system is disrupted. So if someone tells me they can't find their pain, then I already know that they're in a chronic pain state, and then I need to start looking for another way to treat their pain.
Oh, right. So that makes, So then you can go to your expertise and resources in this more holistic approach of looking at the entire person. Could you talk about, I guess, kind of the path you would take with someone? So I'm 6 months into a chronic pain episode, and I'm just saying, Jamie, my back is killing me. How would you address that?
So if you came to me for the first time and you told me that you've had back pain for, the last 6 months. So in my head, I already know that this has been going on for 6 months. There have been changes that have happened.
Yeah.
And more than that, what I know is that when you had an injury, whenever that injury was, your autonomic nervous system was already in a ramped up state. Mm-hmm. And that is a really important piece of the puzzle, because if we can't get the autonomic nervous system to calm down, the pain isn't going to fully resolve. No
matter how many pain meds I take or how much icing I do or anything like that.
Correct. And the psyche aspect of that.
Yeah.
I mean, let's say that individual patient, 6 months, frustrated, achy, hurting. They don't know what's going on. Like, I mean, that mentally would mess with them.
Mm-hmm.
Correct. And this is actually a really good time to bring this up, and because this is a very common scenario, is that, in outpatient physical therapy, sometimes we don't see patients until they've been worked up for 6 months. And so one of the things that, we're pushing for as an industry is to kind of get people through the system a little faster. Mm-hmm. Because it's, if we only have a 3-month window before we get into a chronic pain state, then we need the people to get where they need to be before that 3-month window is up. I know it's
Jamie. Go ahead. Sorry. Go ahead.
Go ahead. No.
Well, this is like, I'm just going to draw attention to this. Like, you have clearly identified a need that would fall under the category of preventative medicine, and so it behooves like the structures of medical care to like take that into account and then say like, okay, so how do we logistically make this happen? And because it's so easy to just say, we stay in our silos, we do our thing, and not like I don't know this, but like taking it back to a senior home care agency. Like, there should be defined markers at 1 month, 2 months, 3 months, because we know that if we get past 3 months in a chronic pain situation, we're now dealing with a different situation. So
yes,
So
like one of the things that I do when I give my lectures is I help people identify the client. I help the practitioners identify clients who are already in a ramped up state when they start treatment. Doesn't matter if the injury just happened, because a lot of times the patient is in a ramped up state. It doesn't mean you can be in a fight or flight response for a reason other than an injury, which is really important to note. So let's say, for in the realm of senior care, let's say that someone has just like moved into an independent living facility from their home, or has moved from independent living or their home into assisted living. That's a huge life stressor. And that's enough to put them in a ramped up state. And then if they are to even, just sprain their ankle, do something that's relatively benign, usually sometimes that pain won't be able to resolve because their body is in a ramped up state. Their autonomic nervous system is still ramped up.
Question. So
yes.
Let's say somebody does that. They transition into a different situation for their living. They come in, obviously they're almost in shock. They're anxious. They're just all thrown off base. Do you treat the anxiety part? Do you treat the top layer of that first before diving into the actual like the pain, or what's that look like from a treatment standpoint?
I would say like ideally it should be like a multidisciplinary approach, and that there should be multiple practitioners involved with dealing with all the different aspects, because as a physical therapist, I'm not able to medically treat the anxiety, but I can treat it from a physical standpoint, and I can treat it a little bit from a mental health standpoint, because as a physical therapist, we tend to develop a very strong rapport with our patients.
Absolutely.
Because we see them so often. So they'll start talking about things. And so if we can get them to talk through things, sometimes that's enough. Sometimes it's not. But if I do know that someone has just moved, my treatment approach becomes completely different. because I do want to start out by decreasing their anxiety. So day one, I don't go in there like guns a-blazing, if you will. I go in there, trying to develop a really good relationship with them. If they need anything, if they need any soft tissue work done, I make sure it's very gentle, so I don't continue to ramp up the system that I need to ramp down in order for them to get better.
I've worked with physical therapists like you, Jamie, and that they make such a world of difference in a senior's life.
Thank you.
I mean, and the family sometimes gave us credit.
That's a beautiful thing.
When it was, our caregivers did what they could do, but it was a wise and empathetic and someone who just cared in a really amazing way. So and the thing is, the pain for anyone, this is going to be a general statement, but pain for anyone is such a vulnerability. Like, it just creates vulnerability. And so, feeding persons, nourishing them with knowledge and with techniques, and then also with hope. And I'm going to go back to what you said at the beginning, how you talked about the two takeaways, that pain is not hopeless, and that you can still be healed and be healing while pain is present. I think that man, blazing, get you on the national stage at the Home Care Association and preach it, because
I'll wear your buttons, Jamie.
All right.
That message of hope is so important. And again, I'm speaking through the lens of a senior. You're seeing people all across the age spectrum. I know that. But yeah, I just want to identify that. That's really cool to hear.
I will say, at the end, typically at the end of my evaluation, provided everything goes the way I'm assuming it's supposed to go, because as a practitioner, we have a list of differential diagnoses that are in our head. We want to make sure those things are aligned with how we think that they should be at the end of the evaluation. If everything is where I think it should be, I always end my evaluation with, "You are fixable."
Yeah, that's awesome.
That's how they go home. They go home, "You are fixable." And I can't tell you how many clients have come back to me and said, you telling me I was fixable, really changed my outlook on this. And that's huge, because that's the piece of the puzzle that needs to happen. We need people to be not afraid to move, because, they're okay. There's nothing, if we do a bunch of testing, there's nothing structurally wrong with your shoulder. So your moving it is not going to do any damage to it. I know it hurts, but let's see what we can do.
No, yeah. I mean, I think it all relates back to a lot of it when you first meet these patients, these clients that are experiencing some anxiety. I mean, breaking down that wall, empowering them to know, hey, listen, you're going to be okay.
Where do you see this going in the next several years, Jamie? Because I have a very limited perspective, but this is new information to me. Meeting you, having this conversation,
pain science and pain industry.
Where do you see it going?
It's kind of taking off exponentially due to the opioid crisis. I would envision soon that we have centers we have pain management centers. I envision soon that they're going to become multidisciplinary, that they're going to become a point of entry into the healthcare system instead of the last place.
Oh, great point.
That people end up, because typically, 60% of people who have chronic pain have seek medical care.
Great point.
From their primary doctor. They go to their primary doctor. The doctors are, everybody's doing everything correctly. They order this, maybe they order an x-ray, they order an MRI, they send them, they're like, okay, we had to send you to an orthopedics. Okay, we'll go to orthopedic, and they have to do another set of images. And this, every step of the way, we're drawing out that process right now. We're drawing out that timeline. And at the very end, when no one can really figure out what's going on, they said, okay, well, let's send you to pain management.
Right.
And I think it needs to be reversed, personally, professionally. If the entry point was the pain specialist and the pain management center, and those centers were multidisciplinary, including therapies, including mental health, I think that, I think outcomes would be,
better,
a little different than they are now. Yeah.
I'll say the word, Jamie. They could be better.
Okay. They could be better.
And that's, you're touching on kind of one of the main reasons that we've kind of come together to do IHS is to be a part of that conversation and push for that. But with an open mind about it, knowing that we don't know this. This was what's so great to talk with you. Sure. And hopefully, we should definitely check in again, to see as it develops, 3 months down the road, 6 months, in a year time. It'd be wonderful to talk again and just recap for the audience, like this is where it's progressed.
Yeah, absolutely.
Jamie, if you had to leave like one last impression for this conversation, what's your message? Your overall mission right now?
My overall mission is to help people understand that their pain is typically fixable and that they don't have to live their life in pain. So if you're someone who is living with pain, I would recommend that you kind of really delve into that and go to see somebody that can really help you through that, whether it's at a wellness center, whether it's a physical therapist, whether it's a mental health specialist, whoever it is that you need to get to kind of get that pain at bay, because you don't have to live with pain.
Beautiful.
Yeah.
Well, you guys, for all those listening, over the last 25, 30 minutes, trust me, we haven't even touched or scratched the surface of what's going on in Jamie's brain and in John Paul's brain. So if you guys at any point want to reach out to Jamie, maybe you have questions, you want to just kind of share your story with her, get her feedback. Maybe you are a practitioner, you'd love to have her come in and maybe you have a speaking engagement, maybe you have a conference coming up, or maybe you're a wellness center where you want to connect her with your clients. Her email is yeshyoucanwellness@gmail.com, and Yesh is YESH, youcanwellness @gmail.com. And John Paul and what he kind of shared, what our mission is going on here at Integrative Health Supplements, you guys. We also, again, part of what we're doing is connecting people with like Jamie to share and create resources for people that are much more knowledgeable in what it is that we're doing. So if you guys want to see what we're doing at Integrative Health Supplements, you can check us out on the web at IHSupps.com. That's IHSupps.com. And yeah, you guys, great conversation.
Wonderful talking with you, Jamie.
Yeah, thank you so much.
Yeah. You guys have a great day. And again, we'll do a follow-up conversation on this in a couple of months, see where things are at. This will not be the last time you hear from Jamie. Jamie, thank you so much for your time. John Paul, as always, pleasure.
Awesome. Thanks, Justin.
Thank you.
Yeah. Have a great day, guys.